Dr. Tom at the Doctors of Physical Therapy, and today we're going to talk about two of our regenerative treatment methods, EPAT Shockwave and EMTT. So I've been around regenerative medicine for a long time. When I first opened my practice here in the Valley in 2016, the things that were coming into light were things like PRP, prolotherapy, stem cells. And so we started doing a lot of business with other individuals in the Valley who did these regenerative treatments where they would inject into tissues to basically rebuild where the tissue damage had become too great. So we're going to talk a little bit about the evolution of regenerative therapies and why I was so excited to bring Shockwave in. So when it comes to regenerative medicine, some terms that you might have heard thrown around are prolotherapy, PRP, and stem cells. And so in the past, we used prolo, PRP, and stem cells, okay, in order to regenerate any tissue damage, like let's say somebody's tendon was torn. In physical therapy, we would fix the movement patterns that led to those tendon tears, and then we would refer out so that somebody could get one of these regenerative medicines in the cases where the damage was so great, so that we could not only fix the movement pattern and the deep cause, but also fix the damage that had been done, creating a good as new type situation. So prolotherapy was kind of the least potent of the three. These are all effective treatments. Then PRP was the next, and then stem cells was the greatest. Now, I was really excited when I started to learn about EPAT Shockwave coming on the market and EMTT because these all require injections. We couldn't do them in-house, and they required people to, for PRP, you either have to give blood and they'll centrifuge it, or for stem cells, they need to harvest it from adipose or from bone marrow tissues, which makes the process a little bit more complicated. And what EPAT Shockwave allows us to do is have the same sort of physiologic benefits without needing to do those. And we can do it here in clinic. It was originally developed to break up kidney stones non-surgically. They would put a shockwave unit over someone's kidney, and it was powerful enough, the shocks that came from it, to break up those kidney stones without needing to cut into someone. So here's a little bit about how it works. So first of all, it brings stem cells to the area and growth factors, okay? And both of those things help to stimulate a rapid healing response. This represents a healthy muscle. Okay, so in a healthy muscle, your force all gets directed straight through a muscle, just like this. Now, let's say that you had a muscular injury and you had scar tissue. Instead of the force going through the muscle, you get some of it going through, but you get some of your force rerouted. So when we leave things like scar tissue in a muscle, it creates a weakened muscle because a lot of that same force is going around these points and through other tissues. So what Shockwave does is it breaks up this scar tissue. And when it does that, stem cells and growth factors come to the area to heal, and that muscle can reform with the right amount of strength training into a healthy muscle where all the force is going through again. So what about EMTT, or magnetolith? You might have also seen it. Okay, a lot of the time when inflammation occurs, it just builds up over time. So we're going to use this cup that an illustration of something that looks like a cup, we'll say. All right, so let's say that this is a pain receptor or something that gives your brain information that there's pain in an area. In order for your brain to perceive that there's pain, this glass has to fill all the way up and spill over. So let's say you have a chronic injury under the surface. That glass is only this full. You're not going to feel pain here. Inflammation is going to build up over time caused by faulty movement patterns, okay? And over time, one day you're going to start having pain as that glass starts to flow over. So what we need to do is get the inflammation all the way back down so that you can undergo a high amount of stress without that pain coming back. And sometimes what happens is as we're recovering, we start to recover a little bit and we get the inflammation down to a certain level, but then we go do something that we're not typically used to, and we get a little bit of inflammation and it goes right back over. Whereas if we can get that inflammation all the way down here and we do something that causes a little inflammation, it might only get to there. So the EMTT helps us get that inflammation down a lot quicker so we get back down to baseline. So here's how it works. It manipulates what's called ion channels. So everything in the body works through ion channels, and the swelling that comes to an area to heal a tissue needs to get through that ion channel to go back out into the circulatory system. Now, if we start sending a lot more swelling into that ion channel, eventually this area is going to have a lot of buildup, and that's what happens here to where that inflammation happens and spills over. So the problem is that this ion channel opens and closes and opens and closes. So it's a very slow system. Okay, what the EMTT machine does is it manipulates that ion channel. It opens the gate and it allows more swelling to go through because the gate is just being constantly open. So it allows it to pull it out, which in turn allows the swelling to come down a lot more quickly. So it decreases pain and stiffness and can be really useful in people with chronic conditions such as arthritis. Okay, even rheumatoid arthritis or issues where people don't really have a lot of options, where their hands are starting to get arthritic, they can come in and we can use the EMTT to get their inflammation down. And we know that over time it'll slowly rise again. But if we can come back in with a little more EMTT and keep that down, then overall they're going to have a lot better function, and it's a lot better than a lot of the options that they currently have. Now, how do these work together? If we have an environment that we're trying to send stem cells and growth factors to, and those stem cells and growth factors are coming to a crowded gate, it takes them a little bit longer to get in. But if we have already used EMTT and removed a lot of the crowd from that gate, these stem cells and growth factors can get in more quickly and do their work a lot more effectively. So that's how we pair the use of EPAT Shockwave, which causes those stem cells and growth factors, and EMTT to clear the area, to prepare the area for actually optimal tissue healing. If you have any questions about these technologies, we're always just a phone call away. You can reach out to us at 480-482-0651.